Hey everybody, it is Wednesday, April 29th, and it's close to the end of the month. And I know I said I wouldn't make a video every day, but I saw this and I had to make this video. So as you know, this is my PNDA Ponderings, and this is where I give you news and information that you should know about and think about, and kind of have ponderings on your own regarding it. So this is about this video that's been going viral that many people have seen. Actually, millions of people have seen this video. It's of two Bakersfield urgent care doctors that talk about COVID-19, and they're recounting their experiences mixed in with some version of extrapolating the data and some conclusions that they've made. Now, millions of people have seen this, and I don't know if you're aware of this, but YouTube has been taking down these videos. So the question becomes, is this a conspiracy? Is this censorship? So first of all, I think we need to break down what the video is and some of that information before we answer some of those questions. So first and foremost, the video is a press conference aired on April 22nd of two doctors who are dressed in their scrubs. They are their names are Dr. Dan Erickson and Dr. Artin Masihi. If I mispronounced Dr. Masihi's name, please forgive me. They're part of the Accelerated Urgent Care Medical Group. They are the only Bakersfield private clinic that allows for walk-in COVID-19 testing. And more importantly, they are not I hate that. Epidemiologists. I know how to pronounce that. I don't know why I'm stuck on it right now. But anyways, you get the point. So what they said really struck a chord with many Americans and who are stuck at home, and they said what we all want to hear, right? That COVID-19 is no worse than influenza. That they said that 12% of Californians have been tested. That 12% of Californians who have been tested are infected, and they extrapolate that to a general population, which means that as many as maybe 5 million Californians have likely contracted the virus. Then they use that number and compare it to the deaths statewide that have been reported, which is roughly 1,200, and they calculate the death rate being 0.03%, which is similar to the average death rate for influenza. So they said that the death rates are low and we should all go back to work and school. And they state that there's millions of cases and small amounts of deaths. So before we get into breaking that down, I want to be very clear. First of all, I am actually for getting back to work. I'm not part of this idea that we need to keep everyone stuck at home and all that stuff. I am an advocate for both the health of us as a people and the health of our economy as a nation and a world. So my goal isn't to say, hey, let's do this or let's do this. It's really just to critically think about it. All right. So first of all, what are they saying? Is it true? Well, there's some problems that scientists have pointed out as major flaws in both their methodology and how they came to the conclusion, as well as some significant statistical errors that they have had in their calculations. The first thing is sampling bias problem. So they can't assume that the patients that they tested who came in for walk-in COVID-19 tests or who sought urgent care treatment for symptoms that they experience in the middle of a pandemic, they can't expect that those are actual representative of the entire general population. Dr. Carl Bergstrom, who is a University of Washington biologist who specializes in infectious disease modeling, gives us an example of how extrapolating the data the way that they have done it is similar to us estimating the average height of Americans by only measuring those who are NBA players on the court. See, the most credible studies of COVID-19 show death rates that are significantly higher than the ones that these two urgent care doctors have presented. And in fact, the American College of Emergency Physicians and the American Academy of Emergency Medicine have both condemned the recent opinions released by these two doctors. So first of all, the way that they're extrapolating has sample bias to it. And the second thing is they have a math problem, or maybe a comprehension problem. I don't know. But here's the thing. They assume that the same fraction of the whole population are infected. So let's say that was true. Even with the sample bias, let's say that was true. Well, Accelerated Urgent Care has done 5,213 COVID-19 tests. of which 340 were positive results. Now, in its 5 Bakersfield location, they've done 5,213 tests, which accounts for a little bit more than half of the total number of testing that's been done in Kern County, which is 9,197. So if that percentage of positive cases were assumed to represent the entire population of Kern County, which is roughly 900,000 people, then it would mean that 58,000 people in Kern County have had the virus, which is far more than the nearly 700 confirmed. So if the numbers are true that 5,000 out of 5,213 were tested at their facilities and 340 were positive, that ratio would mean, extrapolated to Kern County, 900,000 people would mean that 58,000 people should be infected. Yet there's only 700 confirmed cases in Kern County. Now, secondly, they scaled this up to state level and claimed that 12% incidence statewide. But where did they get the 12% from? Since 340 positive cases out of 5,213 is equal to 6.5%. So how did 12% come into play? See, these numbers correlate because with statistics of known deaths as a factored number, meaning like the number of infections, meaning that the number of deaths is stable, meaning we know what it is and we're going to use that number as the guiding point. And if we take the number of infections and we correlate it to the rate of death, they are numbers that are conversely impacted by one another. So if we know the number of deaths don't change, and then if you have a higher infection rate, then that means you have a lower death rate. Vice versa is true. If you have a lower infection rate, then they have a higher death rate. Get the picture? Again, if the total number of deaths don't change, then those two things correlate to one another. See, the thing is, all of this has an impact because the statistics that they use don't actually line up, and then the way that they've gathered data is faulty just by nature of itself. And yet we've taken this and we've really made it a hot button issue. And secondly, not only have we made it a hot button issue, we've made it a extremely politicized issue. There are people on one side that tout these two as heroes, and some of them are calling them brave, while others have described these doctors as self-serving and self-promoters who would benefit from some type of reopening of our state. We know that non-COVID medical visits have plummeted during this pandemic, so it's endangering the practices of many doctors. So of course, if they can reopen and people would be able to see these doctors again, then it would be cause for motivation for them to do so. But not only is the problem being us having a hot button issue on this, the second problem is of YouTube's handling. So as I told you, YouTube has been taking down these videos. Now, why have they been taking down? Well, they have a standing policy to take down any disinformation or misinformation, especially when it comes to COVID-19. That's a standing order that they have. And I get it. I actually appreciate it, and I think that makes sense. But the problem is that YouTube's platform handles situations in the timing that they can best handle it, which is not quickly. They're reactionary as opposed to being proactive. And their policy of removing this is that they trying to do it, but they can't get to it fast enough before it's already spread to millions and millions of people. But by deleting these posts only after they've been broadly part of the public consciousness, they're getting the worst possible outcomes because, number one, the damage of the misinformation is already done. And then secondly, now the people who've uploaded it and shared the information can claim that they're being censored, which further spreads the message and gives it new life again. It's an impossible task. But it completely is impossible for them to try to do it, but they do need to find a better way to handle this. They need to find a more effective way to either work through the deletion or whatever they want to handle with this information. Because here's the thing, deleting these videos after they reach critical mass is actively counterproductive. It gives us these stories a second life, and it kind of spreads it even further. So I want you to think about this pondering is, first, there is a lot that we don't know about COVID-19. And this is why like the organization that I work for intentionally doesn't put out information to tell people what to do about COVID-19, because as an organization, we understand the science and the process behind it, and we understand the need to give time to find the correct solutions to our major problems right now. Secondly, there is way too much divisiveness, and everything seems to be politicized these days, and it hasn't helped anything. There's a possibility that things can be both. It doesn't have to be right or wrong in one way or another way. Think about this way. We love to put things into categories, right? Good, bad, right, wrong. Have you noticed that we tend to do that? Well, have you also noticed that you're not right all the time and you're not wrong all the time? You're not good all the time and you're not bad all the time. But yet we place expectations on a situation that we know very little about, and we expect it to all be good or all be bad, or like have all this information flow into one of these two areas. And the third thing is we need discernment for the information before you spread it. See, YouTube is not necessarily right in taking it down, but they shouldn't have to police it, because we should have the ability to critically think about what information we're taking in and accepting. See, part of the reason they have to police it is because people have lost the ability to critically think. And if you want your life to be free, you need to have the ability to logically think through these things, find out through research of your own what's accurate information, and critically think through the ramifications of the data and the information. Otherwise, you're no better than just a pawn in the world today. And we talk all about our freedoms and how like we value our ability to think for ourselves and do things for ourselves. Yet in most things, we just parrot whatever is out there, whatever sounds sexy, whatever is the best soundbite that we can have without actually researching it. Even places like Snopes and all that stuff, we use these places to find out whether they're true or not, but some of that is politically motivated as well. That's why you need to find from multiple sources. You need to, do research on your own about where this information is coming from, what the information actually says versus what someone's opinion about it, what it says is. Even these videos that I put out for you, I try to make it concise and simple for you to understand. But you need to fact check me too, because again, I'm not perfect. And so my hope is that you ponder these things, that these are ways that you're seeing, wow, like I've been taking things for granted, and maybe it's time for me to actually look and see what's out there. Because here's the thing, I want you to be a person and people group that is free and actively thinking through all the things, all the information that's being presented to you. Because that's the only way that you can truly be free, is without the confines of someone telling you what to think. Anybody that tells you how to think and what to think and forces you in that way, not just offering their opinions to help you understand, but forces you into that way, they have an agenda for something, right? And that's where you need to stand up for yourself and understand that. Otherwise, you're no better than a dumb person that's just accepting everything for what it is. And then you're even worse, because not only are you accepting it, you're propagating it. And you're propagating misinformation. So, my encouragement, think for yourself. Research, find out the information so that you know how to think for yourself. And be well prepared. Thank you for tuning in. I hope this has been a help for you, and I really hope that you're able to take this and do something with it. All right. Have a great day. Bye-bye.